Steve and Debbie have been through it all with the price of healthcare in America. They lived in this campsite for 3 months before a friend lent them the trailer they're in now.
This area.
Right here?
Yeah.
They were forced to choose between rent or buying medicine and healthcare.
We used to sit and cook right here next to this tree.
Debbie underwent chemotherapy whilst living in a tent.
It didn't really bother me that much, like on Tuesday and Wednesday when I had the chemo, but coming Thursday, Friday, Saturday, and Sunday, I felt really weak.
You're very stoic about it. I mean, a lot of people would find it shocking that in America today, you know, someone would be on chemotherapy living in a tent.
Well, yeah, but there's nothing else we could have done, you know.
Yeah.
Here's when I got off at like at 10 at night, and they wanted something.
Despite Debbie and Steve's predicament, Foster Friess, the multi-millionaire back in Wyoming, firmly believes that America has the best healthcare system in the world. A generous philanthropist himself, Foster says you need to keep fit and healthy, and charity should take care of the poor. He fears Obama's reforms will lead to an inept government bureaucracy where fewer get the health care they need.
Do I even look like a cowboy?
In the UK, there's long waiting lists. I don't want the government in a position of creating a system like we've seen in other countries where it's rationed and you just simply can't get it.
The prospect of limited health care is something millions of Americans are afraid of. And Foster is horrified at the cost of Obama's plans, a possible $1 trillion. Through his website, he works on building public opposition to reform. In New York's Times Square, you can't avoid this startling reminder of America's astronomical national debt. The cost of Obama's health reforms may be the lobbyist's most powerful weapon. Obama knows he has a historic window of opportunity to pull this off.
The very first promise I made on this campaign was that as president, I will sign a universal health care plan into law by the end of my first term in office.
Economists on both the left and the right have said the same thing, that what is needed right now is an expansionist policy to really stimulate the economy.
What about a year or two down the road when the consensus in America about the need for big spending is gone?
He's made it very clear that he has to, in a couple of years, really start to cut in order to be able to fund the priorities like universal health care.
But what cuts? Obama is planning to spend $800 billion to stimulate the economy, the biggest spending plan in America's history. With all the forces ranged against him, will he get more massive spending past Congress? Can he achieve what he wants?
There's no guarantee whatsoever. There's huge interest opposed to that. I believe he will try really hard. I believe we're in one of those eras in American politics where that change is possible, but there's never a guarantee.
As Obama enters his first term, all America's hopes are pinned on his promise that his ideals can become reality.
He can almost do anything he puts his mind to. So I just hope people give him the chance.
I'm excited about the opportunity. I'm not sure if I'm coming, but I'm still waiting for the tickets.
But before the ground's even ready for the event, Obama's team has signaled it'll have to negotiate health reform with the industry itself. That raises one big concern. With all he's up against, will Barack Obama be a compromised president?
He is a pragmatist. If he doesn't consult with them, it's not going to go through. He has to be inclusive in order to be able to get a solution through Congress. Doesn't mean that they get what they want, necessarily, but it means they're consulted.
But they're a tremendously powerful lobby, aren't they? That the health sector is.
Yeah, I think that is a concern, and I think it's something that he's going to have to be very mindful of, knowing that you can't give in because you'll end up with the same system we have.
Obama has inherited all the problems of America, including those of Jessica Moberly back in Kentucky. Right now, Jessica is living day to day. Her smaller children don't know how ill she is.
Give me a hug.
But Dalton, her 12-year-old, has been told.
Oh.
He cries every night.
I love you. It's, you know, it's like a time bomb getting ready to go off. It's a time clock every day because they gave me 4 to 6 weeks, and that's been 2 weeks ago. So if I don't get something done soon, I'm not going to be here. Oh, gosh.
When we last contacted Jessica, she still had not received her liver transplant.
Davos Diary in association with Suzlon.